Welcome to Section 1 of Gastrointestinal Pathology. In this lecture, we'll be discussing diseases related to the oral cavity. Let's get started. Here's our overview slide. Let's begin by discussing aphthous ulcers. These are shallow and painful lesions of the oral mucosa. It resolves spontaneously within days to weeks, but is often recurrent. A clear base with an erythematous surrounding can be found on gross examination. Here's an image of this. Notice the clear base with an erythematous surrounding right here. Next, let's discuss Bassette Syndrome. This arises in relation to an autoimmune disorder causing vasculitis throughout the body. Characteristic findings include aphthous ulcers, genital ulcers, uveitis, and skin rash. The overall etiology is still unknown, but this can occur following a viral infection. Next, let's discuss oral herpes. Oral herpes refers to shallow, painful lesions of the oral mucosa that often rupture. It's due to herpes simplex virus type 1, or HSV1. The primary episode of herpes infection occurs in childhood, and the virus lies dormant in ganglia of the trigeminal nerve. The virus may get reactivated, and the oral lesions can recur due to viral infection, stress, or exposure to sunlight. So any of these causes leads to reactivation of the virus, and then the patient develops oral lesions. Here's an image of someone with HSV1. You can see the lesions right here, and these are more commonly known as cold sores. All right, let's do a quick question to help reinforce some of the concepts we've covered so far. A 29-year-old female comes to the clinic for painful ulcers on her lips. She is afebrile. She is a law student and explains that she has been staying up late frequently for her final exams. On physical examination, a grayish base surrounded by erythema is observed on the upper lip. What most likely initiated this patient's condition? All right, this patient is afebrile and is likely under a lot of stress because she's been staying up late frequently for her final exams. On physical exam, there is a grayish base surrounded by erythema. Since she is afebrile and there are no painful vesicles found in her lips, oral herpes is unlikely. Rather, the grayish base surrounded by erythema best characterizes an aphthous ulcer. These are more likely triggered by stress since the patient has been staying up late for her exams. So the correct answer is stress. All right, now let's discuss squamous cell carcinoma. This is a malignant proliferation of squamous cells lining the lips and the inside of the mouth. Risk factors include tobacco, heavy alcohol use, and excessive sun exposure to lips. Oral leukoplakia and erythroplakia are pre-malignant conditions. Therefore, patients presenting with these lesions are often biopsied to rule out squamous cell carcinoma. Let's discuss these pre-malignant lesions in more detail on the next slides. Oral leukoplakia is a thickened white patch that cannot be scraped off. It's different from oral candidiasis, or thrush, as well as hairy leukoplakia, and it's important to be able to distinguish oral leukoplakia from oral candidiasis and hairy leukoplakia. Oral candidiasis is a white patch on the tongue that can be easily scraped off, as opposed to oral leukoplakia, in which the white plaque cannot be scraped off. Hairy leukoplakia is a white, rough, hairy patch on the lateral tongue, as opposed to oral leukoplakia, in which the location of the white plaque is not limited to the lateral tongue. Erythroplakia is an erythematous plaque on the oral mucous membrane and is a premalignant condition just like oral leukoplakia, which means it can develop into squamous cell carcinoma. Here's an image of oral leukoplakia. Again, these white patches cannot be scraped off, and the location of these patches is not limited to the lateral tongue. Here's an image of erythroplakia. Notice how this has red plaques and is often vascularized, as you can see right here. All right, now that we've covered the information, let's review with a question. A 58-year-old man presents with discomfort in his mouth. He denies any trauma to his oral mucosa. He has smoked cigarettes daily for the past 38 years. He drinks 2 cans of beer daily. His heart rate is 94 beats per minute, blood pressure is 142/74 millimeters of mercury, and temperature is 37 degrees Celsius. On physical examination, the physician notices a plaque in the oral mucosa. Which of the following findings would most likely indicate the plaque is a pre-malignant lesion? A white deposit on the tongue that can be easily scraped off. B, a white rough patch on the lateral tongue. C, a white plaque that cannot be scraped off. Or D, a clear base surrounded by erythema. All right, this is a 58-year-old chronic smoker who presents to the clinic with discomfort in his mouth. He also drinks heavily. On physical exam, the physician notices a plaque in the oral mucosa. Oral leukoplakia and erythroplakia are pre-malignant conditions. A white plaque that cannot be scraped off describes oral leukoplakia. Therefore, the correct answer to the question is C, a white plaque that cannot be scraped off. Let's remind ourselves that oral leukoplakia is a white plaque that cannot be scraped off and is a pre-malignant condition. A is wrong because a white deposit on the tongue that can be easily scraped away refers to oral candidiasis or oral thrush. B is wrong because a white rough patch on the lateral tongue refers to hairy leukoplakia. D is wrong because a grayish base surrounded by erythema of the oral mucosa describes aphthous ulcers. So again, the correct answer is C, and that concludes this section.